Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast.
I've got a birth story episode for you today. I'm excited to have Lauren here with me today. She is a follower of Jesus, a wife, a new mom to 1, and a pediatric ER nurse. I love having nurses come on because I am one. So I like to compare experiences and what we brought into our births and how that plays a role, right? Obviously, pediatric nursing is not the same as OB nursing, and Lauren will speak to that as well. But I still think her being a nurse changes her story, and in my opinion, changes it for the better, as you will hear as well. I do want to mention that Lauren does speak about a miscarriage and a loss in her story. And so if that is something that feels tender to you right now or not something that you feel comfortable hearing, go ahead and hit pause and just come back to this episode at another time if or when you feel ready. Hey, Lauren, thank you so much for being here with me today. Why don't you go ahead and introduce yourself a little bit, share whatever you want about your life, your family, and then we'll just get right into your birth story.
Awesome. So my name is Lauren Cowley, and I am a new mom to a 10-week-old little girl named Louise. And I am a pediatric emergency room nurse. I've done that. That's been my only job. So I went to college for that and then graduated and got a job straight into pediatrics, which was great. And then I'm married to a wonderful guy named Ben, and we are in Fort Worth, Texas. And we've got both of our parents close and just lots of family and stuff around us, which is great. So that's about it. Oh, I also have a cat named Dixon. He was my first baby.
Can't forget the cat, your first giant love, baby. Right? Yeah.
Yes, absolutely.
How's Dixon doing with Louise? Is that working out?
Yeah, really good, honestly. We were kind of worried because he's a bigger cat. He's part Maine Coon. And so he's a kind of like a giant cat. He's not fat, just really long. And so he's 11 pounds and he's still bigger than her by a good 3 pounds or so. So we were worried that he would get too snuggly with her because she's a little hot box, but he's honestly either just kind of ignored her or he likes to sleep on her mats and her tummy time mat and stuff because it's cute, squishy. And so he just kind of curls up next to her now when we're out sitting in the living room, which is sweet.
So far the siblings are getting along. That's great.
Exactly. Yeah. For now, maybe not when she starts crawling and being able to pull at him and stuff, but for now, yeah.
Good. Okay. So why don't we go back to deciding to get pregnant and just how that looked for you guys or how that went for you guys?
Yeah. So we actually got married July 13th of last year. So we got pregnant right after we got married. Definitely was not necessarily planned by any means, but we had a honeymoon baby. And I found out about that pregnancy 5 weeks in or so, 5-6 weeks in. And obviously we were really excited. I was more worried because my husband had just graduated college and he had just started a new job in June and we got married in July. And so there were a lot of things back to back. And then we found out that we were pregnant. And obviously that's just a lot. It can be super overwhelming. We also were kind of navigating moving in with my parents to save money because we were trying to buy a house.
Mm-hmm.
So we were newlyweds that found out we were pregnant while we were staying in my parents' house and just lots of firsts kind of all at once. And I ended up having a trip already scheduled to go to Alaska to visit family that we have in Alaska with just my dad. So it was just me and my dad in August. And so I went on that trip, on that flight pregnant. And then I started right before we were gone for almost like a week. And right before we came home, I started spotting. And I knew that, I mean, I was still at that point, I was, I don't know, 7, 8-ish weeks pregnant. And so I knew that that could still be normal, but it just kind of kept picking up. And I just had that feeling in my gut and in my soul. I just knew that something kind of was, something wasn't right. And then by the a couple days later when I got home, I just started bleeding out like clots. And I just knew we ended up going to the doctor and like confirming that there was nothing left in my uterus. My body had completely passed that pregnancy. And that was really hard because there was so much like new all at once with like being married and going on our honeymoon and then finding out we were pregnant and then everyone being super excited. We told our parents, both sets of our parents, and I had told a couple of my really close friends and Ben had told a couple of his really close friends. But we didn't tell like his siblings or my siblings or anything like that just because we knew it was so new and we just didn't want to get people's hopes up because everything had just been happening all at
Yeah.
once. And so then it was kind of like, okay, how do we, now we're newly married and we're trying to enjoy being newly married, but we're also grieving the loss of what we
Right.
thought we were going to get with that child. And we very much believe that children are gifts from God, gifts from the Lord. And so that was hard too, because it felt like, okay, so you started to entrust us with it. And now I feel like it was kind of taken away. And I know that men and women process things differently, especially because there's just a different kind of connection that women have with their kids because you carry them and things like that. But it was hard because we were trying to figure out how to grieve basically like a pretty big loss for the first time together as we had just also gotten newly married and like learning each other's ins and outs and stuff like that too. And so after that, my OB basically said, you could hypothetically get pregnant right off the back of that loss. Like your body treats it like a really late, heavy period and you're going to ovulate again and you could get pregnant. But I wasn't really mentally ready to be pregnant again. And if I'm being honest, we were kind of like, we were doing things to try to avoid it. Like I was tracking my cycle and I was trying to find out my window that I wasn't going to end up being. I was trying to not get pregnant again. And we ended up getting pregnant again right after that. So my cycle just said the heck with it and decided I don't know. So then we found out we were pregnant again. And so that was obviously a mixed bag of emotions because that's who, obviously we have Louise now and that's from that pregnancy. And so I'm so grateful because I wouldn't have her if I hadn't have lost our other child. But at the same time, it's being excited and trying to soak up being pregnant, but also being anxious and things like that. And things were not smooth with Louise's pregnancy either. I physically was okay up until right before I gave birth when I got preeclampsia. But at her 20-week anatomy scan, they thought they saw something in between her heart and her lungs. And so we got referred to high risk. High risk told us that it was a CPAM, which can be pretty intense. And like sometimes they need fetal surgery and stuff or surgery right after they're born. And then I went to in the same practice, but a different high risk doctor within that practice because I just didn't feel like in my gut that was what it was. And she said, no, I don't think that's what it is. But honestly, I don't want to guess about it. We're going to refer you to get an MRI. So I actually had to go to my work because we're one of the only places in our area to get a fetal MRI. So I went to work in a patient gown and had the bracelet on and everything and saw my coworkers when I was walking by and that turned out fine. And so then it was great. We're going to get released from high risk. This is wonderful. But then Louise was showing that she was on the like 8th percentile for growth. So then we couldn't get released from high risk because then they were worried that she was growth restricted. So then it was just another month of constantly going back and worrying about her being growth restricted. And so it just kind of felt like I didn't really get to settle in and enjoy my pregnancy for very long because obviously I was trying to make it out of the first trimester at the beginning because of our previous loss. And so then I had a few weeks before we got our anatomy scan. And then after the anatomy scan, I got the call at work like, hey, we want to look into more stuff. We're not confident that, something isn't there. And then I finally got released from high risk at like 35 and a half weeks pregnant, 36 weeks pregnant. And then I had Louise, I got induced at 38. So there wasn't a lot of breathing room. And that's one thing that I wish that I would have done more in my pregnancy was try to enjoy it a little bit more. I mean, that's easy to say and hard to do when you're dealing with all the appointments and unknowns and, am I eating enough? Am I drinking enough? Like, am I doing the most for her, especially having lost our first baby, even though I know that it's not anything I did, but that doesn't mean that doesn't feel that way. So yeah. And then I had been, honestly, like I said, I had been really healthy. Everyone was just kind of worried about Louise for a while. And then we got released from high risk and I was just going to my weekly OB appointments. And my blood pressure usually runs 110s over 70. Like I've never been really close to 120 over 80. If I'm 120 something, that I know that I've got high blood pressure. Like that's just how I run. And so my 36 and my 37-week appointment, it was 120 something and then 129. And then my 37-week appointment, I was 130, but it wasn't, my diastolic number was still okay. And so, and I wasn't spilling protein. So they said, you're swollen. I was super swollen at that point, but we can't basically diagnose you with pre-E. She still looks great. She's hanging out. We're just going to let it wait. And so I got lunch with one of my best friends, Paige, the day before I ended up getting induced. And I told her, I said, I just have a feeling I'm going to go in tomorrow and they're going to tell me that my blood pressure is high and then I'm spilling protein. I just feel it. I don't know why. I feel like that's what's going to happen. And mentally, I am not ready for that because I hadn't packed my bag. My husband and I closed on our first house less than 2 weeks before that. We closed on May 2nd and I had her on May 18th. So we weren't even moved in. Everything was a mess. There's nothing set up in her room. Our bassinet wasn't assembled. Like things were just chaotic. And so I went into my 38-week appointment and my husband wasn't even supposed to go with me because I was like, I'm just going to pee in a cup, whatever. But he got off work early that day. And he's like, well, I might go to the gym unless you want me to go to your appointment. And I was like, I just have a feeling I need you at my appointment. Like, I really just want you to come to my appointment. And he came and she goes, so you guys are having a baby today? Because I peed in the cup and like took my blood pressure.
And you're like, I knew it.
Yes. It was like 138, 139 over something. And she goes, go home, grab your stuff, and then go to the hospital. So we got to the hospital. That was at like 3:00. We got home, packed. I showered because I took your birth course and I was like, I know that I'm probably either not going to be up for showering or like I'm only going to want to do like a little bit of a shower, not a full shower. And it's not all my stuff and I'm not packed anyway. So I was like, I'm full blown showering. So I got in the shower. My husband was packing our stuff, kind of frantic packing. And we got to the hospital into OB triage at like 6 p.m. on Friday. And my blood pressure when we first got there was 162 over 100.
Wow.
And I wasn't symptomatic though. The nurses, and being a nurse too, at least I try not to be like, I'm a nurse because I know kids really well. I don't know. And labor and delivery is like so out of my wheelhouse. And so I was just kind of sitting there, but I knew that was obviously that's not good. I know that that's not normal for adults.
I just keep thinking too, like, I can't help but think like, oh, I want to say this to everyone listening. Knowing your own normal blood pressure is so valuable because like 128 over 84 is not high for like so many people, right? But if I'm always like 100 over 65, like that can be a little trigger, like you were saying, of like, this isn't normal for me. And obviously they were paying attention and so were you, even in those earlier weeks of your pregnancy. But even like 160 over 100, like you just said, that's high, right? That's high for anyone. But when your baseline is even lower than the average, like you can start to say like, hey, we really need to pay attention to this, right? Like no one would ignore that BP in a pregnant person, but it's still so helpful to know your normals, like going into any part of your OB care, because you can then know like, this is abnormal for me, even if it's not abnormal for my best friend, like that type of thing. So they were just really concerned, like, are you symptomatic? Or is your vision changing? How are you feeling? And I felt fine. I was eating. I was just like, they're not going to let me eat at some point because I know that they're going to be worried about my blood pressure now. And I don't know what kind of meds they're going to want to start. That was also the one weekend that month that my OB was not on call. So I got the hospitalists, which they were great, but again, just not what I was expecting going into my like labor and delivery situation. And so Lauren, can I ask a question? Did you have hopes leading up to labor about like how you were wanting it to go, or,
Yeah.
like natural, unmedicated, I don't want I don't know, like that kind of birth
Yeah,
planning stuff.
it's funny being a nurse, and most of my friends
Yeah.
that are nurses, not all of them, but I think it's funny because we're in the medical system. So you sometimes see how too much medical intervention can start
hmm
causing like the cascade of things. And so I went in very determined to basically, my goal was to go unmedicated. Now, I wasn't opposed to getting IV push pain meds, or my hospital offered nitrous, like if I felt like I needed it to help my body relax. But I really wanted to kind of push my body and test myself, and also just kind of empower myself to see how long I could go without those types of things and see if I was able to really do that. And so my goal was as little medical intervention as possible, whether that was meds or like pain meds or Pitocin or them breaking my water or things like that. I just really wanted, ideally would have gone into labor naturally, right? I wish I would
Right.
have been able to just be at home and labor at home and not have to go and get induced. But that was my initial goal and my preferences. But I had also, I mean, I'm not made, kind of made. He wanted to also, but I had my husband watch the birth course with me, because I was like, God forbid I'm not able to advocate for myself, or something starts going awry, or I'm not paying attention. I want you to make sure that you know what I want and what we want for me. And also then like once our daughter's born, for our daughter, so that if I miss something, it's not just me. And so he was on the same page with that. I also had my best friend Paige that I mentioned earlier. She was supposed to be there also. She was the only other person that I was going to have with me other than my husband, just because she's a super strong, amazing support person. And she had had an unmedicated VBAC with her second. And so everything went wrong for her in her first pregnancy. And so the fact that she then like found the strength within herself and within her support people to be able to do that, like that was who I wanted in my delivery room. But she never takes trips. That was the one weekend she was out of town for a
Of
friend's
course.
bachelorette trip. So my OB wasn't there, and one of my best friends wasn't able to be there. So it was just me and my husband kind of like throw the stuff in the car. Our car seat wasn't installed yet. We like brought the car seat, but it was just a hot mess. And so everything just kind of started moving fast in the sense that it kind of all happened at once. But then obviously once I got to the hospital to get induced, because my body wasn't really, I'm going to say, ready yet, then it went slow, right? So my blood pressure was, 160s over 100. And then their protocol is to take your blood pressure every 15 minutes or every 10 minutes for an hour. And then if you have two high readings within that hour, they start you on 3 pushes of labetalol. And then after that, they go on to different interventions if those don't help. And so my repeat blood pressure 10 minutes later from my 160s was 170 over 100. And so we started labetalol. I ended up having to get all 4 pushes of labetalol before it came back to, it needed to be less than 160 over less than 105. So, and I ended up being 140s over high 90s. And so they said, yeah, you're definitely staying. This isn't like we're going to watch your blood pressure and send you home. You're obviously staying. And so then it was kind of, my brain was starting to kick into gear. Like, okay, like what are the things I need to think about? How is this going to change what I want? Because odds are I'm probably going to end up on Pitocin. I'm probably going to end up with interventions to help dilate my cervix and meds to help ripen it and things like that, that I wasn't necessarily, I wouldn't say I wasn't prepared for, because I did go in with so much knowledge not from my own knowledge from your birth course, but to kind of know what my options were going to be. And so it was just, okay, how are those going to play out? What is going to be offered first? And still trying to advocate for myself within those intervention options. And so, yeah, I got admitted to L&D. The only time I was ever symptomatic, and I didn't even put the 2 and 2 together that this was a symptom, because they just kept asking me if I was having vision changes. And I wasn't. I was still talking. I was still acting myself. But there was one point right before my blood pressure kind of tipped and started to go back down after I started getting medicine for it. My husband looked at me and he goes, "Are you okay?" And I just kind of felt like I was floating. Like I just kind of felt fuzzier, and I just felt slower to respond. I was still talking with the nurses, and the registration woman was in there and she was asking me all of our like address and information and things like that. And so I was still able to answer those, but I could just tell I was kind of fuzzy. And I hadn't initially told my mom, because my mom's a worrier. I hadn't initially told my mom that I basically knew we were going to get induced, because I knew she would start like panicking. And I told my husband, I said, I need you to get my phone, because he was in charge of my phone at this point. I was like, I need you to call my mom and I'm going to talk to her. And I kind of knew at that point, because that's not something I would typically do, that like I wasn't necessarily okay. And so I called her and I was like, yeah, they're admitting us. My blood pressure is really high, but it's coming down, you know, that's all. And I hung up, and that was basically it, which I'm sure sent her into a spiral, because obviously Louise is 10 weeks old, but if she called me and was, you know, when she's older and it's like, yeah, they're, you know, obviously you freak out a little bit. So
like, sorry, mom.
I got up to labor and delivery, and we just obviously were keeping track of my blood pressures, and they were staying like 130s over 80s or 90s. And so I didn't end up needing more meds at that point. But the hospitalist initially came in, and there was some debate on how effaced I was. My OB that checked me said I was like 80% effaced, but it was like a centimeter. And then the hospitalist came in and she said that I was 50% effaced in a centimeter. So, but I was still, Louise was still really high up. They said I was at a -2. And so I was glad that I was at least a centimeter dilated, because I wasn't starting from ground zero. And so that was one of the things my nurses were at least super encouraging about. They're like, hey, you're not starting from square one. That means you can get a balloon if you need it, which is a lot better if you've already kind of started dilating a little bit and things like that. They started me on Cytotec, and I started with that. They wanted to put me on MAG. And like I said, my friend Paige had a terrible first pregnancy experience. And the day before, when we were talking about being induced and things like that, she was one of the few people that got MAG toxicity and delivered at the same hospital that I was now delivering at. And this was years ago, but they hadn't seen that frequently, and they didn't necessarily know what to look for. And her and her husband are both nurses and are super smart, amazing people. And he basically had to kind of get aggressive with the medical staff and be like, no, she's going toxic. Like this is not her. She's not acting right. Like something's really wrong. And they don't usually draw those levels for multiple hours after you start it. And so I was nervous, because I obviously had somebody that I was close to that had happened with, and my blood pressure was coming down. And I knew that if my goals were to have as little intervention as possible, I didn't want to be tied to the bed. I didn't want to not be able to eat or drink. I just knew that if I started down that road, there are a lot of the things that I wanted to be able to do, I wasn't going to be able to do. And so I declined MAG, and they made me sign an AMA form, which I was not expecting, especially being a nurse. Like I've had patients sign AMA forms when they're leaving, you know, the parents are taking their kids and they're, you know, we're done. We don't want any more interventions. We're leaving. And hey, you need to sign this. Or sometimes they don't sign it, but you know, at least write it down in the chart. And my labor and delivery nurse that first night, because it was night shift, she was amazing. And she's like, I've been a labor and delivery nurse for 10 years. She's like, I'll be honest with you. Do I think you need MAG right now? No. But if you start creeping back up like you did, like you're playing with stroking out, seizing, things like that. Like you don't want to be doing that. And I said, you're right. I don't. So we can revisit that if it starts to get to that point. But it didn't. And so I stayed off MAG, which was so great. And I feel like that definitely helped a lot with the things that then ended up coming. And so I was able to get up and go to the bathroom. They had me, because they were just giving me Cytotec and checking my blood pressure and stuff. I was still eating. I was still drinking. I could get up and go to the bathroom. They weren't mad at me about that. They waited till I had multiple hours of my blood pressure being fine, though, before they let me get up to go to the bathroom, because they didn't want me like having some complication in the bathroom and them not knowing that I had gotten up. And so then I got there at 6 p.m. and then Saturday morning, so that next day at like 1:30ish in the morning, I started having contractions every 3 to 4 minutes, and my pain was like very minimal. I hadn't had any pain meds at that point. My blood pressure was still like 130s, and that was kind of it. It started picking up about 3 or so hours after that. So it's almost 5 in the morning now on Saturday. And my contractions are every 2 to 3 minutes. I'd gotten more Cytotec. I was feeling them, and they were going to hold my Cytotec to see, you know, if my body was going to keep progressing on its own. And they checked my cervix, and I was 1.5 centimeters. 60% of face, still at a -2. And my cervix was soft, but it was still really posterior. And so they were trying to see if my contractions would like pick up or level out. And so it leveled out. So we got more Cytotec. And then we talked about how my hospital's policy is they can do up to 6 rounds of Cytotec before they stop doing it. And so I talked to my nurses who I ended up with my triage nurse the night before when I first got admitted for being induced, ended up being my day shift labor and delivery nurse on Saturday, which was really sweet. And so that doesn't always happen. And so that was really nice. And I basically talked with her and my previous night shift nurse when they were doing shift change about the balloon, because they had talked to me, the doctor had talked to me when they came in about doing a cervical balloon. And my goal was to go in and do the least amount of things. And that was not how this was shaping up to be. And so I leveled with them and I said, look, at this point they knew I was a nurse because I was asking tons of like really specific questions.
You can't hide it forever.
No. And so I said, be honest, would y'all do this? If you were having a kid, would this be something that you would do at this point? And they were like, yes, because you're already 1.5 centimeters. So you've already kind of started, your cervix is softening. We're giving you Cytotec. Like this is a great adjunct to that. And so I said, okay, great. So we did the balloon, got up, did all the things like that. My blood pressure started to creep up a little bit. And so then I like went and sat back down in bed, but it also was the way that our monitors were set up is supposed to not take your blood pressure when you're having a contraction, like, because it was automatically taking it, and it did. And so I called my nurse right away and I said, that's not a real blood pressure because it was during my contraction and it was hurting. And she's like, yeah, we'll just wait and see if the repeat one is not the high, because it started to look like it was getting high. And it was not. And so I ended up having one more time that my blood pressure crept up to 170. And so I only ended up with 2 rounds of Libedo all that time. And then it came right back down. And so I was like, great, that's what we're still going to do. We're still going to plan on just kind of like treating it as needed. And then the most wild experience for me was all of these things. It's like the little wins, like the little things that you still could kind of get your birth preferences in. And so my water ended up naturally breaking granted I had the balloon in, but I was not expecting that at all. And so that was really sweet. It was such a weird, again, I can't describe it to my husband. I tried to, like, there's no way to describe your water breaking unless you've experienced it. I feel like, but I honestly thought the balloon had like broken because I just wasn't expecting my water to break on its own. And so I called my nurse and I was like, hey, I think the balloon is out of place. It broke, something like that. And they're like, your water broke, Lauren, come on. And so that was really sweet too, because I was able to kind of pick up that little win throughout my labor process. And so after that, I had bloody show, which was great. I was like 5 centimeters dilated at that point, still really posterior, still at a -2. But I mean, at least my labor was starting to move itself along. But then I knew, okay, my timer has kind of started. So my water broke at 2:45 on Saturday. So almost 24 hours since we had gone to the hospital, 2:45 in the afternoon, I mean. And so I'm like, okay, so by 2:45 in the afternoon tomorrow, if baby's not here, like we're talking about some other stuff. And I had told my labor and delivery nurses, my biggest goal, yes, I wanted to go unmedicated. Yes, I wanted like all these things. But I said my biggest goal was to avoid having C-section if I could. Surgery is really scary to me. I don't do well with general anesthesia. If that ended up needing to be the case, like I just know that that was my personal goal. And I've had friends that have had C-sections and have had great experiences with them. For me, that was just something that if I could avoid it, I was going to try my best to. And so I had a little run-in with one of the hospitalists because there's 2 that are always on call and it's kind of the grab bag, whichever one's sleeping and not. And so I had a little, I don't want to say incident. Again, I feel like being in healthcare, I don't want to say you have a different kind of expectation of those that take care of you, but I feel like, I try to treat my patients and their families how I would want my family and or my kid to be treated. And I had one OB that came in and she was consistently trying to talk to me through my contractions. And my contractions at this point were, I would say like a 5 out of 10. Like they were the kind where I could kind of talk through them, but if I wanted to try to relax my body, I really had to kind of start focusing on them. And so I asked her, I was like, can you wait till I'm done with this contraction? Right. It's like, we're talking like 45 seconds at this point because I've already started it. Like, can we just, and she just kept trying to talk to me through them. And then she said she wanted me to start Procardia for my blood pressure to kind of start taking daily to help level it out.
Mm-hmm.
And I had questions. I was like, okay, so how long am I going to be on this? Is this something I'm going to go home on?
Right.
How often do I take it? What are the side effects? What if I don't take it at all? Like just those kind of like step-by-step processes. Can I have some time to think about it? And she seemed kind of off put that I asked to take. She like talked to me about all those things. And then I said, okay, so can I have some time to talk to my husband about it? And, things like that. Cause she said, I think you'll probably end up going home on it. And again, I've never had, knock on wood, I've never had issues, like health issues, really. Like I've really never been to the hospital. I don't have chronic health problems. Like, so this was a very different experience for me. And she seemed kind of agitated that I asked, and my nurse was in the room when all this was happening. And I looked at her and I said, I really don't want, if I'm going to deliver my baby today, I really don't want her delivering my baby. I already didn't have my own OB. I didn't feel comfortable with how, when I was trying to advocate for myself, how she was responding to me. And so she said, yeah, that was not necessarily the most appropriate. And you do not, like, we can request that the other OB comes if that ends up happening today, which made me feel really good and empowered as a patient that my nurses were like willing to advocate for me. Cause I also know that that's kind of hard when you need something. And now instead of 2 doctors that you can call, there's only 1. And you don't necessarily want to tell them that like your patient doesn't want you back. But, I, having been a nurse and been in that position, I know how uncomfortable that is. And so I was just so appreciative of my labor and delivery nurses that they were advocating for me too, I felt like, and that made my experience a whole lot better. And so, throughout this whole time, Louise's heart rate in response to my contractions, she wasn't having decels, but she was having variables. Like pretty much every contraction, she was having variables. And so I hadn't yet to start Pitocin because they were like, her heart rate's not stable enough. We're not comfortable doing that. And so I was kind of waiting for it to start leveling out, and she just never did. And so then one of the OBs came and talked to me about they're like, we don't know if her heart rate's not correlating really well with your external monitor or what, but we would like to do the internal like contraction monitoring and then her like a fetal scalp electrode.
Yeah.
And again, I had like watched the videos and like learned about it, but again, I didn't think that was going to come to the point for me. And so I talked to my nurses about it, and I said, I feel my initial gut feeling is I'm comfortable with my contraction monitor because my water's broken. I had a balloon up there already that got taken out. Like, I at this point, I'm not, what's the harm, but I don't mind trying to get a better idea of how strong and how intense my contractions are being, especially if they're still trying to put me on PIT, because my nurses said, if you have that monitor, then we can better titrate your PIT and we can figure out that a little bit better, and you might not have to get as much and those kind of things. And so I was really comfortable with that. But I was not comfortable with her scalp electrode. And I said, can we try just doing my internal monitor for my contractions? And if it's still not giving a good read for her fetal heart rate, then we can talk about that. But I would like to at least start with one and not necessarily jump to both at the same time, because they were presented to me from the OB both at the same time. And so that OB said, sure, we can try. And that was good enough, both with my balloon and then with this internal contraction monitor.
Was the balloon still in, or had it come out? Okay.
They took it out. After my water broke, they took it out. And so it took them took the hospitalist 2 tries on both times for my balloon and for my internal contraction monitor, which also, like, I'm contracting at this point like every few minutes. I'm like a 6 out of 10 in pain. I'm trying to breathe through it. Like, that's just not pleasant. Them trying to like do it really quickly in between contractions, or not knowing when another contraction is going to start. And so that was frustrating too. But obviously it is what it is. I ended up throwing up when they put in my internal monitor the first time, just because I was in the middle of a contraction. She was trying to finish it up really quick. I ended up not getting it in. So she had to take it out. And it was just like, I was in so much pain from the contraction and from her trying to put that monitor in that I just threw up. And so I got Zofran then, and I felt better after that. And at that point, I was about 6 centimeters, and she was at like they didn't even really tell me what kind of station she was at, but she had dropped a little bit, but I wasn't progressing very quickly. And so Saturday night, I was dealing with these contractions and my internal monitor, and I was more in the bed now. I'd been up and like laboring around the room, laboring in the bathroom. My nurse was like feeding me popsicles and over the sink in the bathroom. And I kind of looked at my husband, and my contractions were getting worse. And I felt myself not relaxing through them like I had been. Like everything was just tightening and everything was getting worse. And then I was watching her heart rate dip farther every time that would happen. And I just I had this moment, and I looked at my husband and I said, if I don't get an epidural, which like, again, I wasn't going in wanting an epidural, but I was open to it if I needed to do that to avoid having a C-section, because that was my ultimate goal, was to not have one of those. And so I said, I think that if I don't get an epidural now and I keep trying to like grit it out, my body is clearly not, Louise is not doing well with how my body's responding. And I don't want it to get to the point where they're like, we have to take you for a C-section right now. And so I ended up making the decision to get an epidural. And honestly, I felt like that was a really, I'm going to say, sweet experience for me, because the only stories I had heard from people that got epidurals were like my mom's. And she said that she basically felt nothing. They had to tell her how to push, like all the things. And that was just the opposite of what I wanted for my birth. And I was really, honestly, really blessed. I definitely felt like it was very much a gift from God that I could feel both my legs. I was able to still labor on hands and knees, because that's what Louise responded to best. My labor and delivery nurse was not keen on getting me on my hands and knees with my epidural. But she saw that I was like moving my own body weight when they were trying to help. And I was like, no, I can lift my butt up. I can move myself around. It was like, oh, okay. And they were all about trying to get me to switch positions because her heart rate kept dipping. And so I said, just let me try hands and knees. Just let me try it. And if it doesn't work after a few contractions, like we can go back to being on my back or on my side or whatever. But she loved it. And that was the position that we were able to start Pitocin in. So I was really grateful for that. Also, because I had that internal contraction monitoring, they gave me an amnio infusion through that, because they were worried that maybe she's got some cord issues or she's on her cord, and that's what's causing her heart rate to go down and stuff like that. So just like lots of things all going on at once.
I know you're throwing out like all the vocab, like amnio infusion, IUPC, like all this stuff like in the course or as well, though, because it's like when they start throwing all this stuff at you, you're like, I have no idea what an amnio infusion is, or whatever it is. Yeah.
It was definitely less overwhelming, because I at least kind of knew what the things were. And then I had such great nurses that were willing to sit down and like really talk me through what that looked like. What I could, not like what I could or couldn't say no to, because at the end of the day, like I still had the choice, but what would be most advantageous to get me to reach the goals that I want. And so, so I got my epidural at like 8 p.m. that Saturday night. So just over 24 hours from being in the hospital. And I started Pitocin then, because a couple hours after that, because the OB that was on call looked at my nurses and was like, as soon as that heart rate levels out, I want her on pit. Like we need her to start her on pit. Because my contractions were anywhere from like 2 to 4 minutes, but they were still varying super greatly, and they were intense, but they weren't picking up like they should have been. And so I had a great time. I still felt my contractions. I still was in pain. I was still having to breathe through them. But then I only ended up on 4 milligrams of Pitocin. I only got to go up once because her heart rate just wasn't responding super great. And so at 12:30 that Sunday morning now, so like super early Sunday morning, my nurse checked me and she said she couldn't find my cervix, but could feel my baby's head. So, they called the on-call OB and they said, oh, wait, don't let her. And I told her, I said, I'm starting to feel like I have to poop. And all my friends are like, when you start feeling like you're going to poop, that's when, your body's going to start trying to push your baby out. And so I knew that. I told Ben, I was like, I really, really have to poop. Like, I really feel like this is starting. And the OB said, no, wait for me to get there. I want to check her, blah, blah, blah. And so we were waiting. And I looked at my nurse and I said, we can wait, but like, I'm going to start pushing. Like my baby, like I can feel what's going on. And so about 45 minutes later, the OB still hadn't shown up. And so my nurse called back and was like,
It's a
look,
long time.
I know. So I don't know what they got into,
Yeah.
but she was like, look, we're starting stuff. So she wheeled the cart in. I
Mhm.
started pushing at like 1:40 in the morning. And I just under an hour later had my daughter. It was actually the very end of it. Everything just kind of, everything that could have, I don't want to say gone wrong in like a funny sense, but like my OB wasn't on call. My best friend was out of town. Like the things that, you know, I had the OB, I had met her. That was going to be one of the ones that was going to deliver my baby. They had switched from the one that I had previously said I'd prefer her not to come back. She was off that day. So I had two fresh ones, which was great. And the OB walked in because my nurse was like, hey, she's like right there. My OB walked in, she's getting gowned up, and they get a Vocera broadcast over everybody's Voceras. And it said, we have a stat C-section from room 29 or from room whatever. That's a 29 weeker. And so and those were the hospitalist patients. So both of the hospitalists then had to go deal with that in the OR. And so my OB, hospitalist OB looked at me and she goes, I'm really sorry. And I'm like minutes away from having my kid.
Yeah.
Right? She's like, I'm really sorry. I will send somebody in for you, but I have to go. And I was like, okay.
Great.
I mean, like at this point, I'm like full blown, like,
Yeah.
like, you know, I'm pushing her out. I'm breathing. My husband's like, who's going to be here to catch this baby?
Yeah.
Like, so there's a midwife group that runs through our hospital. And one of the midwives came in, literally, I didn't even know her name until after I delivered my daughter. She gowned up. She's like, hi, so you're really close. We're just going to deliver her now. And I was like, okay, great. And I gave like a few more pushes after that. And that was it. I will say I directed a lot of my pushing effort. My labor and delivery nurse asked if I wanted her to help. And I said, if you don't feel like I'm pushing effectively, or if you don't see her starting to move down, then please tell me. But my body was like starting to do those things anyway.
Yeah.
So, and because I got really lucky with my epidural, I felt all the things. And so I was like, I feel like I know how I'm needing to push. They also really wanted me to push on my back, and I wasn't opposed to that, but I was like, I would rather try to push on my side. I just felt better kind of being on my side and kind of like having the bed to kind of hold on to instead of being crunched. And again, they said, we'll let you try. And if her heart rate's not doing good, then we're going to switch you into what we want. And luckily that worked fine. So I only ended up pushing on my back for the last couple pushes because the midwife came in and she was uncomfortable with me pushing on my side. And I was like, at this point, I don't care. Like she's like 3 pushes away from me being here. So
right.
yeah, so I pushed her out, and I'm really glad that it came with the last push that it did, because her heart rate dropped to like 40. And I didn't hear this. Again, you're just in your like labor bubble. But my husband said that my nurse was like, oh crap, because like the thing dipped real hard. And she came out, and I told them, I was like, I want to wait till her cord turns white before we cut it. And obviously like they do skin to skin right away and things like that. Her cord was really short. So I think that probably had something to do with it. And it honestly looked puny. Like it was skinnier than I was expecting and than what they were expecting. And so they put her on me, but I couldn't really pull her all the way up to me. She kind of had to sit like down here because my cord was shorter. And then they gave her an APGAR scores of 8 and 9, but I feel like 8 was being kind of generous because they took her from me after like a minute, and they took her to the warmer because she was not pinking up very great. And so they basically looked at my husband and they said, I know you guys want to wait till you cut the cord until it turns white, but it came out white. Like there was not, they're like, it's not pulsing. There's nothing to it. So are you okay with us cutting it? And he was like, yeah, that's fine. And so then he went with my daughter to the warmer while they were trying to stimulate her and kind of wake her up a little bit, pink her up. I ended up with a 1st degree tear, which was also really sweet. And I think a lot of the fact that I had a 1st degree tear and that I was able to be on a lower dose of PIT and things like that was because I let my body do a lot of the work at the beginning. And I waited till I was 6 centimeters before I got my epidural, and my body had kind of progressed a lot on its own. And so I was really grateful for that too, because I felt like, again, not that you have any control necessarily over how much you tear, but especially being a first time mom, I just know that the incidence of having a more significant tear is a little bit higher
Yeah.
the first time around. And I was really grateful. I had one external stitch and a couple internal stitches, and that was it. And so that was really sweet. Everything that happened for my labor process, I would 100%, I would go through labor again. My postpartum experience was very different, and I ended up needing blood because I lost 1,300 cc's right after I gave birth. I have like a right leaning uterus, which I didn't know, but they thought that my bladder was distending my uterus for a while. And so they ended up trying to calf me 3 different times to get what they thought was urine out. And they basically got no urine out. And that was really that was worse than pushing her out, was getting a calf right after. Everything's like all swollen and
it's not fun.
And they took my Foley out right before I gave birth to her, obviously from my epidural. And so that was a hot mess. And then I didn't end up with blood until the day after I had her because they checked my H&H and it was low. And then I ended up 5 weeks postpartum, ending up getting a D&C. So I had retained placenta, which went undetected for 5 weeks. My bleeding got better, and then it started getting really bad again. And again, I should have listened to my own. I felt like I listened to my gut really well during my labor process, but my postpartum, again, it's all new. I'm a first-time mom. Like, I kind of knew that things were going sideways, and being a nurse, I've never called 911. I try to avoid going to the hospital. Like, I don't, but I ended up I almost passed out in the shower. I like fell on the floor of our shower from bleeding so much. And I had my husband call 911, and we went to the emergency room when I was 5 weeks postpartum and got a D&C. And since then, I've been doing a lot better. I feel like I finally have been able to kind of start. Not only does it help that now I'm 10 weeks postpartum with my daughter, so like her little routine is starting to normalize a little bit, but I feel like my hormones are finally starting to level out, which, I mean, if I think about it, like my body was half trying to be pregnant because it was continuously feeding my placenta. It was super vascular and what was left anyway. And so, but my body was also trying to be postpartum. And so I just felt like there was a lot that I hadn't really gotten to like stabilize mood wise. And I know that we go through like so many hormonal swings and some of that's normal, but I have felt so much more myself and able to, my mood swings that come naturally with being postpartum and things like that. I feel like I'm able to handle them a lot better than I was at the beginning. And so just lots of my initial unmedicated dreams and less intervention dreams kind of like went to the wayside, but I still feel like I can speak super positively about my birth experience because I had great nurses and great support within the hospital setting. And also because I had a good base knowledge of what might be offered to me based on how my situation was changing. And obviously my daughter's doing great. She's been fine. She was born 6 pounds, so she was a little nugget, and she's almost 9 pounds now. And so I would do all of it again to have her or to have another one of her, but it definitely was not how I initially thought like my whole process was going to go. So
Lauren, no, it's perfect. I like listening to your story because you kept pointing out like little wins and priorities and ways where you could still kind of like grab the reins back. And I think that that's a super valuable thing to take into the hospital setting of like assuming all is not going to go exactly like I want to, like if it were not to, like the ability to say like, I'm going to like take this for myself and I'm going to take this for myself. And I'm going to see like I grabbed this because I had to say, or I had to let this go. I just think it's such a valuable skill to walk into our births with wherever we want to deliver or however we want it to go. Because I think that a lot of times we're going to have to make a concession about something. And maybe it's small, like I wanted to wear my own thing and it didn't happen or whatever, but there's also maybe some big concessions coming. And so it was just kind of cool to hear you process or tell that out loud, how you could see places where you're like, no, I still was there and I owned this. And I got to say that was my choice. And I had a voice inside of that and stuff. Cause obviously that's like a huge thing about hospital births or those who have trauma as well, as like, I felt like I didn't show up in any of it. And so
Mhm.
if we can like take that back a little bit, like to me, that's the beginning of better stories, maybe not perfect stories every time, but definitely better
Yeah.
stories. Yeah.
I think too that the having the mindset that I knew even if I, didn't end up needing to get induced and none of that kind of
Mhm.
stuff happened, I still knew that there were probably some things that they were going to suggest or going to want to do, or
Mhm.
even if I declined them, like they would still
Yeah.
bring them up. And so I think just going in with the mindset that like one of the things I really took away from when my husband and I watched your course that I like just kept repeating to myself was that their preferences or priorities, not like this is 100% like a set plan. Like because
Mhm.
I'm the kind of person, like I'm super type A in the fact that if I'm making a to-do list or if I'm making a plan or if I'm setting out to do something, like that's what I want to do. And I knew that if I let myself kind of get into that headspace of, well, these are the things that I planned, if it didn't go according to my plan, because it needed to change for the safety of
Right.
me or my daughter, that I knew myself and I knew that that was going to make me probably spiral a little bit. And
Mhm.
so I just went in saying, these are the things that are most important to me. And if I can achieve these things, over here, but these things are kind of up in the air, maybe I get them, maybe I don't, that's okay too.
Yeah.
And I think that focusing on what few things were super important to me helped because
Yeah.
I really feel like if I would have delayed my epidural with how her heart rate and stuff was going, especially how I saw it even right before I gave birth to her and ended up pushing her out, I really think that I would have gotten steered into a C-section direction,
Mhm.
which would have probably been to benefit her. Obviously, they wouldn't just like
Right.
have me do that for no reason. But my nurses, knowing that my goal was to avoid that, were super honest with me and upfront. And even the first full day we were there, they said, I know that you and, ideally would not want pain medicine or an epidural or things like that, but would you take an epidural over getting a C-section? And
Mhm.
I was like, yeah, I would. And so that helps kind of
Mhm.
reprioritize too, because
Mhm.
it helps when you trust that not, I mean, obviously I trust my husband and stuff like that, but he's not medical at all. So he was kind of like a deer in headlights with all the things,
Mhm.
but trusting my nurses and the people that were around me taking care of me definitely made it easier to let go of the things that didn't matter as much
Yeah.
in the long run. And so I'm just really grateful that it happened the way that it did and that I was able to pick up the wins that I could.
Yeah.
So,
Yeah.
yeah.
Well, it was a great, like, I just again love hearing it, a hospital birth story that you can come out of it and say that and feel that way and say, hey, there's care providers who showed up for me and they were so valuable. And that's the goal, right? Like that everyone gets that L&D nurse where they're like, she literally helped me do this. And so we can't always know that's going to happen, but definitely when it does, it's just such a gift too. Okay. I know you mentioned being a student in your body or birth. Were there any other resources, books, podcasts, things that you love that helped you prep for babe or postpartum too?
Honestly, no. With all of
That's okay.
the like
You had a lot
moving
going
and
on.
buying,
Yeah.
yes, I was going to say all of the things happening all at once. It was hard to find time to finish the birth course anyway because
Yeah.
I wanted to sit down and do it with my husband. He works a normal 9 to 5. I was off. I left work early because I was super swollen and uncomfortable, and
Mm-hmm.
my doctor was like, "You need to be home now."
Mm-hmm.
And so it was hard to find time to finish that. But I remember the week before I got induced, we had like half of it left. And I looked at him and I was like, we have to crank this out this week. I just know we have to crank this out this week. And I want to make sure that we're on top of it.
Yeah.
And so we did. And literally, we finished it, I think, 2 days before I went to get induced. And so I also just talked, I mean, just like I feel like a lot of people, I just talked to people around me that had had different birth stories. And I feel like
Mm-hmm.
that helped too, because like my friend that had mag toxicity, super rare, but I know that that can
Right.
happen, right? And so I felt like if I did need mag or they put me on it or I started having symptoms again and I needed to be on it, I felt like I at least knew kind of what to look for because it's one of those things that gets thrown in the air and it's like, yeah, it's super rare though.
Right.
But and then my mom had an epidural and went in wanting an epidural. When she was pregnant with me, I was almost 2 weeks overdue. And so like she had a completely different birth story. She was like,
Mm-hmm.
I didn't go into labor on my own at all. I got to the hospital and immediately wanted an epidural. And, you know, my friends have had C-sections and natural births and in a hospital. And with a midwife group at a birthing center. And I think that helped a lot because I kind of got to, just like with raising kids, right? Like you get to get wisdom from the people around you, but then you get to pick and choose the things that fit you and what your goals are. And so that was something that was pretty much all I did other than that. And pray a lot.
Yeah.
So much all the time.
A lot of prayer.
Yes. Just that everything could go okay and that she was healthy and that I was healthy. And then when I started to not be healthy, it's like, okay, but can I still stay relatively healthy with how it's already kind of started to turn, those kind of things. That's pretty much it. Lots of prayer and
it sounds like it served you well, honestly.
It did.
Okay. Where, if people wanted to ask you like a question about something that came up or wanted to reach out, is there somewhere that you feel comfortable they could do that? Instagram, email, anything like that?
Yeah, they can definitely reach out to me through Instagram. My Instagram's public.
Okay.
And then, it's my maiden name. So my maiden name is Marines. And it's funny because people always think that it has some like military affiliation, but no one in my family's ever been in the military. That was just our last name. But yeah, my Instagram is L for my first name and then Marines. And that's it. And I would love, I think also being a nurse, like I just love educating and being able to talk about stuff. So I'm an open book with all of the things.
Okay. We'll put it in the show notes so someone can have that if they want it. And then last thing, just for fun, what's something in your life that's just sparking a ton of joy for you right now?
Sparking a ton of joy. I would say my husband and I have been going through old Disney movies like that were made in the 1960s. So we watched The Sword and the Stone. We're watching Jungle Book right now. And that's kind of how we've been winding down at the end of the day. We were doing, series, like new series on Netflix or whatever for a while. And then we kind of were like, you know what? We kind of miss all those like super old cartoons that we used to watch when we were younger. And so we've just been going through like the Disney catalog of like old cartoons and movies.
That's so cute.
So yeah, that's been really sweet. How we wind down at the end of the day now. So
is Louise going to bed at like a normal time yet, or is she then still up with you guys? Because you're right at that point, it feels like.
Yes, she has been, she'll go to bed. Her last feed is anywhere from like between 10 and 11:30 at night.
Okay.
And then usually she'll sleep until at least 5.
That's great.
The other night she slept till 7 and it freaked both of us out. We were we woke up and we were like, what is going on? But she's mainly bottle fed breast milk because her latch is terrible. And we had to get tongue, cheek, lip, tie, all the things revised. And so he feeds her in the middle of the night and all pump.
Okay.
But like last night she got up at 4:30 and then she went back to sleep until we woke her up at like 9 to feed her. So she gets like 2 good chunks usually of sleep on either end. But the one night she slept through the night was...
I know, it always freaks you out the first time.
Like, what is that? Like, what's going on? And then, of course, she went right back to her normal self, waking up in the middle of the night.
Yeah.
Today.
Yeah.
But
I love that movie and baby time because eventually they will like go to bed earlier, but you're still kind of in that spot where I feel like so many newborns, don't really go to bed, however you want to say that, until 10, 11 or so. And that's when they're truly like down for the night. So that'll change. But I always like to know what people do in those like 8 to 11 p.m. hours. So Disney movies, I love it.
Yep.
Well, thank you, Lauren, for sharing your story, for sharing all the like little bits and the wins and stuff. I loved hearing it. So thank you.
Yeah, thank you. I appreciate it a lot. And thank you for having me. Your course was great and it helped me a lot. And I feel like that was one of the only reasons that I felt as prepared as I did. So
good.
Just thank you. And thank you for all the education that you give out freely all the time.
You're so welcome.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.